The Neohaler is a single-dose dry powder inhaler or DPI delivery device. Like all of the DPIs, the Neohaler requires an appropriate inspiratory force and patient effort. Therefore, it should be inhaled with a quick, deep breath to deliver the medication appropriately to the lungs. Let's watch as Mary explains to Mrs. Ryan how to use this device.
Hi, Mrs. Ryan. I'm Mary.
Hi, Mary. Nice to meet you.
It's nice to meet you. Your clinician has ordered a new inhaler device for you. It's called the Neohaler.
Okay.
And I have one here for you.
Gosh, it's tall and small.
And it actually comes in two pieces. In the box, you'll get the medication delivery device along with some capsules that actually have the medication in them.
Oh, okay.
Okay, so let's go through how to use this. And I'll kind of talk you through, I'll show you, and then I'll have you do a return demonstration for me. How's
Okay.
that? Okay.
So I should just hold on to it right now?
Okay, yes. Or you can sit it here. So you grab the base of this and pull the top off. Okay, this is just a cover. This is actually the mouthpiece. And as you can look down inside there, and there's a little mesh thing.
Yeah.
Well, you don't want to stick the medication down there. What you'll do is actually open it, like so, and you can see where the capsule will fit.
Oh, yeah. Kind of mash it in there.
Let me show you. So you would remove the capsule out of the package, and you'll want to make sure that you don't remove the pills or the capsules out of the package and put them in. Some people use little medication, daily medication devices. You wouldn't want to do that, okay?
Okay.
You want to keep it in this container until it's ready to use. And then you just push the capsule through, like so.
Oh, okay.
And you'll drop it down, like so. And it only fits in one way.
Okay.
Okay.
It's important to emphasize to patients a few points about the capsule and this device. First, as mentioned in the video, the capsule must stay in the blister pack until it's ready to be used because moisture in the air may cause clumping of the powder. This clumped gummy powder cannot be inhaled and may get stuck in the capsule without getting into the lungs. Therefore, patients should never put the capsule in a pill box and should not open the blister pack until it's ready to be used so that the powder stays as very small particles that can be successfully inhaled through the Neohaler into the lungs. Next, patients should never use a knife or any other sharp instrument to open the blister pack because it could puncture the capsule and the powder could spill out, reducing the amount of medicine that gets into the lungs.
Then you close the mouthpiece over, and then you have these two little buttons on the side here, and you will mash or press those one time and release.
I heard a click.
And you heard a click, and that actually is puncturing the capsule so that the medication is now ready to be inhaled into your lungs.
Oh, okay.
Okay, so once that's done, you don't want to tip this over or blow into it or get moisture into it or anything like that.
Okay.
Okay.
The Neohaler should be held upright when pushing the pink buttons so that the medicine does not spill out the top when the capsule is punctured. As mentioned in the video, the device should not be shaken or turned upside down because the dry powder may be lost and not available to be inhaled into the lungs.
So you'll want to empty your lungs completely, like so. Put the mouthpiece in. And hold it. And then exhale. And you should hear a little whirling noise. And you can look inside and make sure you got all the medication. Now, did you see where my little capsule kind of had moved up a little bit? It might have been stuck in there because I didn't really feel like I got the medication, or I didn't really hear that whirling noise. So let's try this again. And I've already punctured it, so I don't want to do that again. But just kind of make sure it's down in there. Press the top on again, blow all your air out, and Okay, did you hear the difference?
I heard the whirling noise, yeah.
That means I took a deeper breath, the capsule was in the proper position, and the medication was delivered.
Oh, yeah, yeah.
During Mary's first attempt to demonstrate how to use this device, the capsule was malpositioned in the device. Therefore, we did not hear it rattle. Hearing this whirling or rattling noise is important because it provides an auditory confirmation that the patient is inhaling deeply enough and that the capsule is positioned correctly so that the medication appropriately reaches the lungs. Because no rattling was heard, Mary opened the device, noticed that the capsule was malpositioned. She then repositioned it back into the well and inhaled more quickly and deeply during her second attempt.
So again, you'll want to hear that whirling noise, hold your breath for at least 10 seconds afterwards, remove the mouthpiece, and you can look and see, and if there's any medication left in the capsule, and this one is stuck, but you can see that the medication has gone out of the capsule. So I have actually taken all of the medication, but sometimes people can't get it all in one breath, and you can make sure the capsule is there. Make sure that it's in place again. Put the mouthpiece on, and then you could take another inhalation with it that way.
You should emphasize that a patient can inhale a second time using the same capsule, but should never use a second capsule because that would be too much medicine to take at one time.
But the trick is to take a deep, quick breath.
Deep, quick breath, you hear the whirling sound.
Okay.
Correct. And the other thing, let's just kind of go over this quickly too. Once you've taken your dose of medication, you'll want to dispose of this capsule, and by doing and just throwing it into the trash, not really handling it, but just kind of dumping it into the trash.
I see.
And you wouldn't want to store the next capsule inside there.
So you put it in just like fresh beans in a coffee pot.
Yes, that's a good analogy. And then you would close it like so.
Okay.
You want to go ahead and let's try this together here
Sure.
again one
Sure.
more time. Or actually, I think you got it. Let's go ahead and have
Oh,
you
you have
demonstrate
faith
it.
in me.
I do.
Notice how Mary asks the patient to demonstrate how to use this device on her own without coaching. To be sure, Mrs. Ryan will be able to correctly inhale her medicine once she is on her own and out of the office.
Okay, Mary. Just pop this off and open this up. Now the hard part, getting this out of here, right?
Sometimes it's a little difficult.
That was an understatement.
Just push it through.
Push it this way.
Yes.
Ah, got it. And I'm not supposed to handle it?
You can actually take the capsule and place it into the chamber.
Okay, good.
Making sure that it can only go in one way.
Okay.
Sometimes they get a little sticky, so.
Okay, and mash it.
One time.
One time, okay.
And when you put it up to your mouth, one thing I forgot to mention to you is you want to make sure that you have it, you're holding it properly. You wouldn't want to turn it in the other direction.
Okay.
The pink buttons that are used to puncture the capsule should be on the patient's left and right rather than on the top and bottom for the patient to adequately receive the medicine through this device.
And
Okay.
I didn't hear
I didn't either. And one other step I think that you forgot was to actually empty your lungs. And that may be why you didn't hear that little whirling noise, is because you weren't able to take in as deep a breath as you needed to.
So if I take a look now, I'm going to see it's looking just like it did when I started out.
Okay.
Notice how Mary provides feedback to this patient and pointed out that Mrs. Ryan did not appear to breathe out very much before she tried to inhale the medicine. This may have impaired her ability to receive the medicine, as evidenced by the lack of a whirling sound when she tried to breathe through the device. Watch as Mrs. Ryan repeats the steps to inhale the medicine correctly the second time. As Mary explains in the video, it's important that patients do not puncture the capsule a second time. The patient may just look to be sure the capsule is positioned correctly and then inhale more deeply and quickly the next time.
Let's try this again.
Good job.
Must be a good job. Empty.
Great, great. And you can go ahead and dispose of that capsule now. Yeah, they stick to it a little bit. And you'd probably want to clean off the mouthpiece, and you can just use a dry, lint-free cloth to clean that.
Okay, and then I just store this until the next time I need it?
Yes.
Okay.
Great job. Do you have any questions?
No, that really seems easy, Mary.
In summary, the box that the patient receives from the pharmacy contains the Neohaler device and individually wrapped capsules with the dry powder inside. The capsules should remain in the blister pack until just prior to use. Once inserted in the Neohaler, the capsule should be punctured by the pink buttons on each side of the device and then inhaled within a few seconds to minutes after puncturing the capsule so that the medication does not clump from moisture in the air. Common mistakes that patients make when using this device include opening several blister packs at once to place the pills in a pill box, shaking the device after crushing the pill, swallowing the capsule, which doesn't hurt them, but it sure doesn't help the lungs if it's swallowed, and not inhaling deeply enough to hear the capsule whirl or rattle. Therefore, it is very important to address these potential mistakes when teaching patients about the use of this device. Finally, as with all inhalers, make sure that the patient demonstrates to you each step appropriately without coaching, which is called return demonstration.